It's doctors referring you to doctors, referring you to specialists, referring you to another specialist.
Before we get into mine and Sonia's conversation about diagnosing and treating endometriosis, I just wanted to say thank you for being here and apologize. There's a lot of jump cuts in this video. I was so sick when we did this, but I didn't want to put off the recording, so we did it anyway, and so I had to cut out a lot of my throat clearing and coughing, and so I do apologize. It is a little jostly in parts, but please forgive me and come back, and I promise I'll just get better.
Getting a diagnosis is
Frustrating.
Yeah, that is definitely a good word for it. I was gonna say a long experience, but frustrating is a great way to summarize it all.
Right. So women normally don't get a diagnosis for, I think the average is like 7 to 10 years.
Yeah.
It's a long time. So if you are having symptoms of endometriosis, painful periods that keep you from your regular activities, heavy bleeding, pain in other areas like your bladder, your legs, your kidneys, back pain, these are all signs that you could have it.
Yes.
Say probably. There are other things that cause it, but these are things that could be endometriosis, right?
Yeah, it's kind of like, hey, maybe look into it because it could be one of those things affecting you.
Right. I think one of the things that distinguishes it is the level of pain.
Yes.
Endometriosis pain is out of this world.
Yeah, it is. It is out of this world pain. It is. I literally feel like swords are in my pelvic area.
Right.
Like it is definitely a stabbing, sharp pain.
Right. Yes. So I have experienced that as well. Dull, achy pain, but to the next level.
Yeah.
Achy to the extent that like your back hurts so bad you don't want to move. Right. The achy legs, like the pain level, I think is a really good indication. So let's say you have a suspicion that you have endometriosis. You're right now going through this trial and error process.
Yes.
Basically.
It's doctors referring you to doctors, referring you to specialists, referring you to another specialist. And so that's kind of the process that I'm in right now. I'm like talking to a specialist and he wants to get in and do this surgery. I'm also thinking about looking into getting a second opinion, not necessarily to get diagnosed, but maybe a specific other treatment or a way that insurance might be able to cover more over the other, if that makes sense.
Yeah, it's really difficult. So going to many doctors is probably the first step. And then once you kind of find a doctor who's willing to track this down with you, at that point, some of the methods that they use are imaging. Typically, endometriosis is not seen on imaging. MRI, again, it takes a really specialized doctor to read those studies to know what they're looking for, and even then it may not be seen.
Yeah.
Let's talk about ultrasound really quick. I'm not sure why we didn't mention it. Ultrasound will probably be one of the first things that a doctor will order to start pinning down some of your problems when you start trying to figure out what might be wrong with you or if you end up in the emergency room. Ultrasound cannot diagnose endometriosis. There's a common misconception that it can. If they look and they see your uterus and your ovaries and they can tell that your ovaries are adhered to your uterus, a lot of the times the doctor will take that as you have endometriosis and tell you that they found endometriosis on your ultrasound. Technically, ultrasound cannot differentiate between tissues, and so it can't differentiate between your organ tissue and endometrial tissue. So it's just not sensitive enough. I do ultrasound, so I know a little bit about this. So I don't know why we didn't talk about this, but we didn't. So I just wanted to add that in.
Only true way to for sure know that you have it is through laparoscopy. Yes.
Laparoscopy. It's basically they give you itty bitty incisions and they go into your stomach or your pelvic area and they take a look in your insides and see if they could find any lesions, any endometriosis, any adhesions. Speaking of adhesions, tell me more about that.
Adhesions.
Yes.
So adhesions are scar tissue. That's another response, immune response from our body. It creates scar tissue when those lesions bleed. If you've had any abdominal surgeries, such as a C-section, then you're more prone to that scar tissue building up if you do have endometriosis. And so basically what those adhesions do is just like they adhere, they glue your insides together.
Okay.
So your insides are supposed to be able to move around so that when you twist and bend and move, they move with you. When you have adhesions, they're stuck. They're stuck together. They're stuck to each other. They're stuck to your abdominal wall, your pelvic cavity wall. Like they can be stuck anywhere. And so movement becomes restricted and painful.
So adhesions are kind of almost like tissue glue.
Yes.
To put it in like the only way that the simplest way.
Exactly.
Yes.
That's what they're looking for during a laparoscopy. You want a trained endo specialist to do your laparoscopy because even though you would think that so many women are affected by this, that a regular gynecologist would know what they're looking at, they don't always know.
Yeah.
I have a personal story of my first laparoscopy. He went in there, he saw the adhesions, he saw my uterus, he saw everything. He took the adhesions out, which made my condition so much better. I can move again. But he told me that I was negative for endometriosis because he did not see any. The issue is he didn't know what he was looking at because it was clearly everywhere. But he was looking for something specific, I guess.
Yeah.
That's my only explanation on that. They were looked at by a specialist, 10 years later, and the specialist saw those surgical pictures and was like, oh yeah, there's definitely endometriosis in there. I had already argued, but anyway, that doesn't matter. So
yeah,
you want a specialist if possible. I will say that if that's not possible, you live in a rural area like us, sometimes it just gets to the point where you have to do something and maybe you don't have a specialist, but you have a doctor that goes in, and like this doctor did, even though I got a negative diagnosis and that was disheartening, taking out all that scar tissue helped me a lot, and it helped for several years.
Yeah.
So I don't regret that surgery. I didn't know that I needed to seek out a specialist at that time. I was not as educated as I am now. But I would say if you have that option, that's the best option.
Yeah, and that's where I'm at right now. I'm looking into specialists and trying to get that help.
Yeah. So that's diagnosis. That's right now the only way that they can officially diagnose you.
Yeah. And so while I have all of the symptoms and my pain is taking over everyday life, technically I am still not diagnosed with it, because in order to do that, I have to have the laparoscopy test.
Yeah.
And so that is like hard to sit with, is the best way that I can say that for anybody out there, because that is the only definitive answer to know that you do have it right now. And that can be kind of disheartening.
Well, it can be. I will say that you don't need an official diagnosis to start treating your symptoms.
Yeah.
You can start treating your symptoms with things that we know help, with the heat, with the TENS units, with pain medications. you're not going to hurt anything.
Yeah.
You might as well assume that that's what it is until you're told otherwise.
Yeah.
I would say.
Yeah, I might as well just try to treat my symptoms as if they were endometriosis until I'm proven wrong.
Right.
Once they go in and they find out that you do have endometriosis, what is the next step?
Well, there's no cure. So this just gets better. Our medical system is lacking in women's health. That is just a fact.
Yes.
There is no cure for endometriosis. But assuming that you were able to go to a specialist to have your laparoscopy done, that specialist is trained in removing endo lesions. In Dr. Cook's case, he will start at the diaphragm with his camera. He will check every nook and cranny behind every organ to look for lesions, and while he's going, he will remove them. I had this done. I had many lesions removed. We can go into where those were another time, but basically we'll just say they were from here all the way to here. So when you come out of surgery, if you've had a lot of those adhesions and lesions treated, it can be a process of recovery. I woke up from that surgery. I felt like my insides were on fire, and it took a lot to get that pain under control. But going forward, I felt a lot better, and I was able to function once I recovered from that surgery. So I'd do it 1,000 times over if I had to.
Yes, and
please no.
and that is our main goal, is to get back to functioning.
Right. Yeah. Because it takes everything away from you. As the pain progresses, it just does.
Yeah. Yeah, that is our main goal, to get back to functioning. However, the only way to do that is to get into a specialist who actually knows what endometriosis is and how to safely remove it.
Correct. Yep. After having it removed, then you kind of go into maintenance mode where you try to minimize the scar tissue by massage and yoga and keeping yourself moving, keeping all that tissue pliable and moving. And you just try to maintain the results as long as you can.
Yes.
With diet, and that's kind of that. But there's no guarantees. It can come back, and it often does. I think the best specialists have about an 80% cure rate, which is awesome. But that means 20% still have recurrence of endo after their excision. If you don't go to a specialist, I would assume that number is even way higher.
Yeah.
Like way more people would be
having it
afterwards.
Again.
Yes. Yeah.
So that's kind of where we ended off with our discussion about diagnosis and treatment. I feel like it was really abrupt. We went into other subjects that didn't relate, and then it got cut off. And so I just wanted to end out this video by saying, if you are somebody who is looking for answers because you're experiencing pain, infertility, the issues that plague those of us that have endometriosis, I just sympathize with you, and I would just say keep going and understand that it's going to be probably a long fight. It's hard when you're in pain to just have that strength and that attitude that you can get to the answers that you need, especially with all the frustration of seeing doctors that don't believe you, of having tests run and they're negative. And it's grueling and it's hard. And so my heart's with you. Keep going, keep pushing for answers, and hopefully the medical system will start to do better by us. That's my hope. So thanks for being here, and look forward to the next time. Thanks.